Hi, my name is Moreno, and this is my audience. My sister, my mom, and my nephew. According to the National Alliance on Mental Illnesses, 15 million American adults are affected by major depression every year. Compared to other medical illnesses, it is the leading cause of disability in the United States. I will now depict what factors of a person's life major depression affects, who it affects, and what we can do to stop this life-changing disorder. Let us begin by exploring what major depression consists of and what factors of our lives it changes. First of all, although we may all face moments of sadness at times, people with major depression face sadness on a constant basis. The exact cause of depression is not known. However, according to the Depression Center, psychological, biological, and social factors all play a major role. Genes play a major role in many cases, which means that people with depression have relatives that also have depression. It runs in the family. Stress could be another reason for depression. The death of a loved one, financial problems, relationship problems can trigger depression. Personality. People who self-criticize, with low self-esteem, who are pessimistic, are more susceptible to depression. Medication can have depression as a side effect also. An individual's emotions, thoughts, behaviors, and health are affected. According to the Tank Center at UC Berkeley, people with depression become very emotional. They feel hopeless, helpless, guilty, anxious, irritable. They begin to have thoughts of death and suicide. Their behavior changes. They no longer want to go out and have fun with friends, hang out. They lose interest in fun activities. They do not take care of responsibilities. They do not feel like going to work, doing homework. They do not keep up with personal appearances. And also the physical strength weakens. They don't want to do anything anymore that exerts any kind of force. They feel too weak, they feel tired. Now that we have more knowledge regarding how major depression is caused and what factors of people's lives it hinders, let's take a look at who depression affects. According to the Tank Center at UC Berkeley, major depression does not convey personal weakness, nor is it something that you can just simply shake off. Major depression can affect anybody: children, adolescents, young adults, middle-aged adults, or seniors. Major depression does not know of ethnicities, and it can affect men and women. It can affect any religion and any culture. Although we have discussed who can be affected by depression, let us take a look at the tests that can help us know if we have depression and the treatment options available. According to Med9+, people with major depression believe that their situation cannot improve. They feel like they're always going to be stuck in that oppressive state. If you go to a doctor for help because you think you have depression, they will begin by asking you questions regarding your symptoms and regarding your medical history. Your responses can make it easier for the doctor to find out what type of depression you may have. Furthermore, blood and urine tests may also be necessary in order for them to eliminate any other medical conditions that may have the same symptoms as depression. Treatment options include medications called antidepressants, which can be very effective in eliminating the symptoms of depression. However, you should always be very aware of any negative side effects that they may have, such as hallucinations, which you should always consult a doctor with. Children, adolescents, and young adults should be monitored during the first month of medication to make sure that there's no suicidal thoughts or behaviors. Talk therapy can be another option for treatment. Cognitive behavioral therapy is a type of talk therapy that teaches you how to recognize your symptoms and overcome negative thoughts. Psychotherapy is a form of talk therapy that can help you discover the reasons behind your feelings and your thoughts. Support groups are also very helpful because you are with people who are facing the same situation that you are, who know what you're going through and who can relate to you. Now that you have a better understanding of major depressive disorder, I will depict the main points once more. In conclusion, major depression should be recognized and treated properly. Anyone can be affected, thus we should not belittle anyone's remarks regarding how they feel due to age, gender, ethnicity, culture, or religion. People need to know the symptoms of depression in order to know when to seek help. There are several treatment options, so people need to know that their situation can improve.